Are you suffering from sleep problems in perimenopause and menopause, and you want to learn how to fix it? Hi, I'm Dr. Patricia, holistic medical doctor with a root cause approach to health, and welcome to the Wild Wisdom Show. Today, we're going to be talking about menopause sleep problems, causes, natural remedies, and hormone therapy for quality Z's, because you deserve a really great, rejuvenating night's rest. Now, it's interesting to note that the rates of self-reported menopause sleep problems affect between 40 and 56% of women, which is higher than the amount of women affected before menopause, but still in their late reproductive years, and that rate is 31%. So our rates of menopausal issues do go up as we go through that menopause transition. And we can classify those sleep disturbances in menopause into three groups. You can either have trouble falling asleep, you can wake up several times, or you can wake up earlier, or you could have a combination of both. And it seems like waking up several times is one of the main issues that women have in perimenopause and menopause. And there are a variety of root causes that we're going to go through. And depending on the root cause, the treatment strategy differs. And we're going to go through all of that and more. So, one of the root causes are the changes in the level of estrogen, progesterone, and what's called follicle stimulating hormone, or FSH, as we go through that menopause transition. So, naturally, what happens as we go through menopause is that our estrogen levels start to overall decline, go down, as does our progesterone. And as a result, the follicle stimulating hormone goes up because the body's trying to stimulate more production of estrogen and progesterone from the ovaries. But the ovaries are starting to run out of eggs and they can't keep up with that demand. So over time, we get changing levels of these hormones. And it's interesting because the brain actually has what's called receptors for these hormones, which means that these hormones interact with the tissues in the brain, and that interaction either supports or changes the function of brain. And sleep, our ability to sleep, originates in the brain and is triggered by brain activity. And different kinds of brain activities will trigger wakefulness or sleepiness. And it's also influenced by hormones like melatonin, for example. So what we've noticed is that in the research, it shows that as the estrogen levels decline, as progesterone levels decline, these can cause a problem with sleep, and also that increasing FSH can as well. And that's one of the reasons why women who undergo surgical menopause, which is what occurs when you have one or both ovaries removed, or if you have your uterus removed, even just removing your uterus can affect blood flow to the ovaries. So you can have a more severe menopause when you have either your uterus, one or both ovaries removed. And the most severe happens when both ovaries are removed, as well as the uterus with that. And as a result, the very little estrogen and progesterone that is being made by the ovaries is completely gone, because even in menopause, our ovaries are still making those hormones, just in much smaller amounts. And so we have a bigger deficiency in these hormones compared to people who still have their ovaries intact. And so these individuals will have a much more severe sleep disturbance issue than those who still have their ovaries present. And depending on whether this is your issue, we're going to be talking about the different strategies that you can try in order to improve problems with your sleep. Now, the other root cause for problems with sleep disturbances in the menopause transition are night sweats. In medical terms, they're called vasomotor symptoms, in the sense that your body has a difficult time controlling your temperature. That's also coming from the brain. So temperature regulation and control happens in a very complicated way from the brain in various different regions of the brain, involving very many different kinds of hormones, both in the brain, which are called neurotransmitters, going out to the body, as well as the brain to nervous system connection. And the nervous system regulates how our blood vessels work. And so that happens to be one of the major causes of sleep disturbances for some women, in that they wake up in the middle of the night just pouring sweat, very hot, flushing face and upper body. And that can be enough to really disrupt sleep and make it hard to stay asleep and go back to sleep. Women with moderate to severe hot flashes, which are technically considered to be 6 to 14 days affected in a 2-week period, are almost 3 times more likely to suffer from frequent awakenings compared to women without hot flashes, also in menopause. So it can be a very significant root cause for problems with sleep. And other factors that are associated with aging is the third root cause. So while we are going through menopause, we are also getting older and we are more likely to suffer from more chronic medical conditions that can affect sleep, like obesity, cardiovascular disease in terms of heart health and brain health, gastrointestinal problems, urinary problems. So some women will get up more frequently to go pee. That is turning out to be also as a result of menopause, primarily because of the declining issues with the estrogen, which causes changes in the tissues, both in the vagina and the urinary tract, which can increase our risk of having an overactive bladder or even urinary tract infections. There can also be an increased risk of other endocrine problems like hypo or hyperthyroidism, for example. Chronic pain syndromes are more likely to occur as we are older versus when we are younger. And medications, we tend to accumulate prescriptions as we get older, and many medications actually interrupt with the quality and quantity of our sleep. So these can all add up. And one of the big issues that actually can go undiagnosed and directly affects our sleep is what's called sleep apnea. Now, before you gloss over this thinking you don't have this issue, let me inform you that sleep apnea, while it's classically thought to be an issue in people who are overweight, and so when you're lying down, that extra weight gets in the way of your breathing. So you're not breathing, your apnea, no breathing. So that's the technical term, is the apnea. But what's really happening is that you're not breathing as well when you're sleeping. So you're getting less oxygen to your brain. And that decreased oxygen in your brain actually affects the quality of your sleep. So you wake up feeling very groggy and maybe even with a headache, definitely very fatigued and tired. Now, what we're learning is that you don't necessarily have to be overweight to have this issue. You can actually be slim as well and develop this issue, and would be more likely to be called a central sleep apnea, in that it's originating more from the brain and the nervous system. And it could be related to the changes in those hormones as well as we're going through menopause. So if you're waking up with any degree of like fatigue and grogginess and even like a mild headache, I would definitely go to your doctor and ask to be screened for this, because if you don't detect sleep apnea, that decrease in oxygen to your brain can put you at a much higher risk for a stroke as well as heart attacks, increases your risk of death from all causes. And it's so easily diagnosed and treated. And once you treat it, you instantly feel better. So imagine going from feeling super tired and fatigued and headachy in the morning, a bit groggy, to feeling energized and alert and just ready to go, full of energy for the day. So it's really worth making sure you don't have this issue if you think that this may be an underlying root cause for you. The thing to know is that the awakenings from sleep apnea are actually rarely detected. You don't really feel it, you don't notice it. So it's not like a complete awakening, but it'll be just enough to pull you out of deep sleep so that you don't get that restorative sleep. And that's when you start getting significant effects on your health. So now let's go through some natural strategies that you can use, because the thing is, if we focus too quickly on the hormone therapy, for example, we're going to lose out on many of the other root causes that can be quickly and easily fixed by some lifestyle changes. Because I'll tell you, when I see patients and when I work with the clients, it amazes me how we're unknowingly engaging in some lifestyle choices that have been creeping up on us over the years, maybe even since we were children, that seriously disrupt our sleep quality. And maybe it was okay when we were younger, but as we get older, it really starts to affect us because our resiliency to that goes down. And for example, the first one that we look at is light exposure. So what we do know is that our melatonin hormone, which is our deep sleep hormone, requires a period of darkness, but not complete darkness, but rather a lack of blue light exposure about 2 hours or so before you go to bed. And so that's around 8 p.m. at night onwards, ideally. Okay. And that has to do with what's called our circadian rhythms, our rhythms through the day, our natural rhythms around the day, circadian. And what that sets is the rhythms for wakefulness and sleepiness. And so if you're exposing your eyes to blue light around 8 o'clock onwards at night, you're basically telling your brain that it's daytime so that you don't actually feel tired when you go to bed. You might feel awake, kind of maybe even thoughts racing in your mind. You're not quite ready to go to bed. So either you try to go to bed or you can't. Or maybe you go to bed and you fall asleep, but then you wake up. And that might be because of that lack of melatonin production, which gets seriously cut down as soon as your eyes see blue light, because that blue light gets transmitted to your brain as a signal that it's daytime. Blue light can come from your fridge, from your Kindle, for example, your blue-black lit reading devices, your phone, your computer, your TV. So, for example, purchasing a real blue blocking glasses, which block 99% of blue light. This is not the kind of glasses you would wear during the day when you're on your computer to block that minimal, like that tiny amount of blue light. What you want to do is get the one that has the lenses that are amber colored. They're like an orangey color. And companies like True Dark, for example, make excellent options and basically put them on anytime after 8 o'clock. And for your phone, if you check your phone at night, or if you're looking at your phone, or maybe you're using it as a timepiece at nighttime, you'll want to turn it onto a red color filter. And you can do that manually in your settings. Just make that color filter red. The night settings, the night shift, are okay for transitioning from 6 o'clock to 8 o'clock, but not okay after 8 o'clock or 9 o'clock. It simply isn't red enough. Red light is one of the few lights that won't harm that melatonin production. The other kind of healthy light exposure you want is in the morning, is the sunlight. It's that morning light before 10 a.m. has a specific color variation happening in the sky and brightness that you can't mimic indoors no matter what kind of light you use. It's present even during cloudy, rainy days. And so if you get outside for at least 5 minutes before 10 a.m. without sunglasses on, without even reading glasses on or seeing glasses on, just let that natural light filter into your eyes. Don't stare directly at the sun. It's not necessary. Light does filter. And that light will come into your brain and tell you it's morning time. And it'll set the rhythms of hormones for the day. So proper sunlight exposure in the morning before 10 a.m. and proper avoidance of blue light exposure after 8 p.m. will make sure that you are supporting your appropriate sleep rhythms as well as the melatonin hormone production. So if you want to learn more about this, I have another video, another show that I made called How to Optimize Sleep for Hormone Health. You'll want to go and check that out. Look for it in the search bar on YouTube, or if you're listening to this on a podcast, look at previous podcast episodes with that title. But you're going to want to definitely take a look at this if you think that this is something that you might accidentally or unknowingly be messing up. The second one is stress reduction, because did you know that your hormone that is called cortisol, and it's your stress hormone, when it's made in too high amounts, your body will start to pull and use progesterone in order to make the cortisol, because it's one of the building blocks of cortisol. And if that continues for long enough, it'll even start to use the building blocks that are necessary to make estrogen. So now if you're in a chronic stress state, even though you may be coping with that stress in terms of being able to do all the things and check off your to-do list, if you're not engaging in daily, doses of deep relaxation, like some meditation, some breath work, some walking in nature, those kinds of gentle exercises like Tai Chi or Qigong that really decrease your cortisol stress response, you may run into issues with your hormone balance that could actually make all of your menopause symptoms worse, but in particular, your sleep could be significantly worse. So not over exercising, because that can cause too much cortisol, but rather the thinking about those doses of deep relaxation through the day to really calm down the nervous system so you stop overproducing cortisol hormone. The next natural strategy that we want to look at is nutrition. And what's interesting is that multiple studies, and this is one called Dietary Patterns and Their Association with Menopausal Symptoms, a cross sectional study published in the Journal of Menopause in 2019. And this and many other studies have shown that what we eat affects menopause. Okay. So things like sugar and highly processed foods actually make our menopause symptoms worse. Vegetables and fruits make our menopause symptoms better. Vegetable seed oils, including mayonnaise that is made with things like canola oil rather than olive oil or avocado oil, those all seem to negatively affect menopause. So it's really interesting that paying attention to your nutrition can actually make a big difference for your sleep in terms of quality as well as timing. So if you eat food too close to your bedtime, it will negatively affect your sleep because it'll cause your body to go into a state of digestion. And that state of digestion basically blocks the deep state of relaxation. So stopping eating around 8 o'clock at night is also ideal. So 8 o'clock seems to be a really great time to kind of hone in, make sure you've stopped eating and you've started paying attention to your blue light exposure. And that will help you set yourself up for a really great sleep that night. And then one of the last natural strategies before we head into supplements is exercise. So the right amount of exercise is so key because if we get enough exercise in the day, we're more likely to be tired and ready for sleep. And so when we have things like enough cardiovascular exercise, even walking, doing something that you enjoy, ideally outdoors in nature, getting about 150 minutes a week of moderate intensity exercise, and you can divide that up throughout the week, doing a certain amount every day. That seems to really help with our brain health and menopause, which supports sleep. And so making sure that you're really focusing on the exercise bit so that you get enough of it to tire you out, but you don't go too high intensity interval training that will actually increase your cortisol stress levels too high, which could lead you into that cortisol stress hormone steal issue of taking away from your progesterone and estrogen. So finding the right balance is key. Again, I have made a video in the past called How to Exercise for Hormone Health. And if you want to go deeper into that, I highly recommend you check that out as well. Now we're going to go into supplements. Now, this is so interesting because there are supplements that can really support your sleep. And part of this is research and also lived experience for myself, my patients, and my clients. So the supplements that I really love to go to are magnesium bisglycinate or threonate. Magnesium threonate is the kind that goes more to the brain, so it can be more relaxing for the brain, whereas magnesium bisglycinate is more into the tissues and also helps the brain. But if you start with the magnesium bisglycinate, which tends to be cheaper and more affordable, and that's not enough, you've reached the maximum dosing on the bottle, then you might want to try the magnesium threonate. The other supplement that is quite helpful, is L-theanine, so Theanine. And that's a molecule that has been isolated from green tea, for example, and it's a balancing to the caffeine molecule so that teas that have more L-theanine, like the green teas and herbal teas, is less likely to have issues with caffeine because it's got a counterbalancing effect. And when they isolate this, it can actually be a very calming effect, which for some people can really help that sleep management. So taking it at night can actually help support your sleep. Now, melatonin I mention here because it's such a popular one, but it is a hormone. And I find that a lot of people actually dose it too high and they might be overusing it. And for me, it's the last option to consider because it can be so easy to overdose hormones if you're not careful. So a dose of 0.3 to 1 milligrams should be more than enough to support sleep. And remember, you can't out-supplement, for example, too much blue light at night. It doesn't matter how much melatonin you give yourself. If you're giving yourself a lot of blue light exposure at night, you're simply not going to experience your best sleep. So things like melatonin really should be only a last case resort, added on to what you have already done in terms of supporting your natural strategies that we've talked about so far. Herbal remedies are interesting because there have been actually a few specifically studied in menopause. So there's so many herbal remedies out there, but I'm going to focus here on the ones that have been really looked at in the case of menopause. Now, it's really only a few studies here and there for each one, but it's interesting to see the ones that actually worked for the menopause-related sleep disturbances as opposed to general sleep disturbances. So, for example, there was a study that compared pollen extracts compared to isoflavones, which you find in products like soy, for a period of 6 months. And the pollen extracts did much better for supporting sleep than the isoflavones did. So, that was an interesting study. Another study looked at using Salvia officinalis, which is a fancy word for sage, wild sage, culinary sage, garden sage, basically the sage family. And they did an extract of 300 milligrams a day for 3 months, and sleep was also improved in this study. And these are all, by the way, randomized controlled trials where they give one group the therapy and the other group they give something that might look like it, but actually isn't the treatment. And the improvement has been with these kinds of trials, which means they're very good quality studies that even Western medicine doctors would say is the kind of research they would want to see to prove that these herbal remedies work. The other study was something called Dracocephalum extract. So that's Dracophalum extract, 250 milligrams twice a day for 1 month, also beneficial in menopause-related sleep disturbance. I looked that up. I had never heard of it before. It seems to be some kind of a plant or flower variety. So I'm not even sure, to be honest, if this is something that you could easily find, but I did come across this research and I wanted to share it with you in case it is something we could easily find, or it becomes something that we could easily source. Now, I did find a variety of studies on traditional Chinese medicine herbal preparations, and they appear to be very promising, and some had really great results. I can't share all of them with you because there were just so many of them, and they are usually used in a combination that is provided by a practitioner who assesses you, determines what kind of deficiencies, like yin deficiency or yang deficiency or heat or dry, those kinds of things. And then they'll make a preparation for you. So it's not so much that there's a one go-to herbal supplement, but rather that seeing someone who is experienced in this and knows how to prescribe could be beneficial to you. And some studies even show that when you combine them with acupuncture, it can get even better results. Other herbal remedies that have been studied for general sleep, not specifically menopause, include rhodiola, valerian root, and passion flower. So it's good to know that these actually do have research behind them and they can be beneficial. And you can just try and see which is the one that works for your genetics and your unique hormonal situation or medical, or how your body health is doing. How does it interact and how do you do with it? If you are on prescription medications, be sure to talk to your pharmacist before trying any of these to make sure that there's no unwanted interactions, because these are medicinal and you want to make sure that you're not running into any issues with your existing prescriptions. And that's the job of your pharmacist, to do it for you, to really run that check for you. So be sure to take advantage of that service. So now we're going to dive into hormone therapy. And what's really interesting is there are tons of studies on this actually. And it seems like when the issue is vasomotor symptoms, so the hot flashes, there's pretty good response with the use of estrogen therapy, which you can use alone if you don't have a uterus. So estrogen either through the skin is usually the way to do it. You don't want to take estrogen by mouth. It can increase your risk of clotting too high for any kind of added benefits of taking oral estrogen, in my opinion. So definitely the research shows that it can increase your risk of clotting by as much as 200% if you take it by mouth. But if you put it on your skin as a patch or a gel or a cream, it's very safe and well tolerated, as long as you're working with a prescriber to make sure you're finding that optimal dose. And if you do have a uterus, you want to use a progesterone with that as well, and either in the vaginal area to protect yourselves from endometriosis. That's the concern of being on estrogen alone, is that it might increase your risk of uterine cancer or endometrial cancer. But if you take that with a vaginal progesterone or an oral by mouth progesterone, that risk is gone. So as long as you're using bioidentical estrogen and bioidentical progesterone with someone who knows how to prescribe those therapies, which is unfortunately at this point in time, typically not your family doctor or your gynecologist, unless they've done additional training in hormone replacement therapy. not birth control therapy, okay? Don't use birth control for menopausal issues. It's the wrong dose, right? You don't want to prevent fertility in menopause, so the dose is totally off. And there's much better formulations like bioidentical patches and creams and gels, and you can really make sure you're on the right dose for your problem. So just a little tip there. Now, what's really showing up strong for sleep issues that aren't related to vasomotor or hot flashes is the use of what's called oral micronized progesterone, which is basically progesterone that is bioidentical, it's the same as what your body makes. You take it by mouth and it's micronized so that it's very small so you can absorb it through your gut. And it seems like there is a really unique effect of progesterone when taken that way on the brain to induce a state of sleepiness. So you would take it at night, and there's actually 9, at this point in time, 9 randomized controlled trials. So again, that kind of study that even Western medicine doctors are really happy with. And they've used that a total of 388 women studied, primarily postmenopausal. So that those number of studies will go up over time, which is great. And most of those studies had an improvement in sleep outcomes. And just as an anecdote, I do have loved ones in my life who are in menopause, who are having problems with their sleeping. And actually, that problem can come on even after you've been menopausal for years, if not decades. And then they tried the oral micronized progesterone with really wonderful effects. Now, some women run into side effects, in which case you might want to ask for a lower dose, for example. But for some people, that's not the ticket, right? So you want to make sure that you're not suffering through side effects and, communicating with your prescriber to make sure that you're getting the dose that's really appropriate for you. So the take-home message is that sleep disturbance in perimenopause and menopause requires a holistic approach. You can't out-supplement or out-medicate a lifestyle that is sabotaging your sleep. So really work on those foundational bits and then add on the supplements, the herbal therapies, the hormone therapy on top of that. Okay, so make sure you've got the lifestyle in place. And remember, if you're like most people, you probably are actually unknowingly sabotaging your health through other means. And it's just that when you're younger, you had more resilience to it, right? And there is also that estrogen decline, the progesterone decline, and all of those things. So making sure you're addressing all of this will give you a better chance of achieving your sleep goals for those quality Z's. I hope you found this helpful. If you did, please share, subscribe, save. Sharing is caring, and you never know when someone that you love might benefit from this wild wisdom. And I look forward to seeing you next time.